All right, thank you. Good evening, everyone. Welcome to tonight's department budget hearing. We will have two presentations tonight. The first one will be the Health and Human Services, and then it will be followed by the Human Resources. My name is Councilman Amilcar Hernandez. I am chair of the Operations Management, Budget, and Government Accountability Committee. This meeting is broadcasting live on HPA-TV's Xfinity Government 96, and Frontier Government Channel 6032. It will also be streamed via HPA-TV.org, HPA-TV Facebook page, HPA-TV Apple TV, Amazon TV, and Roku TV apps. It will also be made available on the HPA-TV YouTube channel. I would like to acknowledge everyone present here tonight. On the screen, we have Councilman Alex Thomas. To my left, Councilman John Gale. To my right, Council President Shirley Surgeon, Majority Leader Merly Rossetti, Councilwoman Bilodeau, and in a few minutes, Council Assistant Majority Leader TJ Clark will be joining us as well. Tonight's first presentation will be the Health and Human Services Department, and tonight with us, we have Director Ebony Jackson Shahid. Ms. Jackson Shahid, you may introduce your team alone, and then you can start your presentation. Thank you.
Thank you. Yes, again, my name is Ebony Jackson Shahid, Director of Health and Human Services for the City of Hartford. To my left, I have Mohammed Korte. He is the MSO for the HHS Division. I also have Miss Elizabeth Kavanaugh. She is the Chief Sanitarian for the City of Hartford. And I also have my Deputy Director of Social Services, and that is Patricia McIntosh. And on the very end, we have our management and budgets for our City of Hartford, Julian Freud. Would you like me to begin? Okay.
Yes, please.
Thank you. So the Department of Health and Human Services aims to protect the well-being of Hartford residents, to promote an environment conducive to healthy lifestyles, and to prevent adverse health outcomes through needs assessments and the provision of quality services. This is our organizational chart. With me at the department head, I do have an executive assistant, and I have two deputy directors. So I have my Deputy Director of Social Services, who is over the Human Services Division, and I have my Deputy Director of Health and Human Services that is over our clinical services. And that is our disease prevention, our epidemiology division, and environmental. And I am over administration. There does say, it says administration vacant, but those individuals are directly underneath me. So that is our finance, that is our internal personnel, and that is our emergency preparedness coordinator. So they report directly to me. So our highlights, we have many highlights and achievements that we have done this year. We implemented an electronic medical record, EMR or EHR, for improving billing. Our system is called CureMD, and it is there for the reimbursement of funds when we charge for services, as well as, to build revenue. We have received our HHS mobile clinic. We're very excited about that. So our mobile clinic is licensed, just like our clinic, and we will be using that as an education tool for the community. So we will be, using it. Most of our divisions will have a schedule where they can use it for education. So for example, our lead outreach team, they can take out the mobile unit and they can bring it to different zip codes within the City of Hartford and do lead outreach. So it's going to be a tool that we use to help improve our outreach skills. We reviewed an updated competitive salary to improve retention of EHS sanitarians and trainee positions. I think that this is very important for our division. I think that we have become more competitive for environmental division. As you all know, there are not many environmentalists in the state of Connecticut, so most municipalities are fighting for those positions. So I think what comes down to it, honestly, is the salaries. Most municipalities kind of shift back and forth with employees, and it just becomes a competitive situation. But I think right now, the way our department is situated with a trainee program and then moving up once they learn skills into the environmental sanitarian position, that, you know, we are building a system for retention. We have a fully staffed rodent control inspection unit. Our rodent control team at this point has become a model for many areas in Connecticut. We do have 3 rodent control inspectors, and we have gotten a lot of support for that unit for the things that they need as we prioritize rodent control for the city of Hartford. Developed a comprehensive rodent control plan for the city and deployed new rodent control tactics. A lot of people have heard about our new techniques or our gassing techniques that have been extremely efficient, and we are actually in the process of getting another machine so that our rodent control team has additional tools that they can use for prevention. We were invited to a regional environmental health conference to present, and basically it was the Norway rat control in the city of Hartford, a public health perspective, where our rodent control inspectors were looked at as professionals and experts in that field, and, you know, they really wanted to hear what our plan was. We have also gotten calls from other municipalities because they heard how well our rodent control plan is going, and they wanted some assistance with that. We created an aired HHS documentary called Complicated Confidence that was sponsored by the CDC. We've gotten lots of feedback from our documentary, really about vaccine hesitancy, and that was something that we were able to pay, sponsored by the CDC, but through the immunization grant. We actually recently submitted Complicated Confidence documentary to the American Public Health Association for publication. And so we will see if we get accepted for presentation, and then we'll move forward with a publication for that film. We had a statewide HOPE conference hosted by Ryan White. So the HOPE conference basically was in collaboration with other organizations across the state of Connecticut, and it really was talking about prevention of HIV. And so that was very successful, and that will be something that we will be doing annually. So some continuation of our highlights for Human Services. We implemented various departmental committees according to accreditation requirements. We are undergoing FAB accreditation. So we are required to have different departmental committees before we make, and I don't want to say policies because we already have citywide policies, but health department guidelines. So we have implemented those throughout our division. MIOP has completed their annual community engagement event, which was a community baby shower. However, we implored them to do another event this year, which they are spearheading, out of the concern for several residents who have had issues during their pregnancy, and they were clients of ours. So in hopes that we, collaborate with our hospitals, our community advocates, just around residents knowing their birthing rights. We are having another event May 8th that is talking about maternal child health and birthing outcomes. We completed the Yale study for seniors, the therapeutic dance that improves cognition and emotion, and it's basically called T-DICE. This was a very successful study, and a lot of our seniors really would like us to do it again, and perhaps at another center. So we are looking into seeing if we can possibly get that done for another senior center. We have our 4-part home ownership education series, and that was completed with our Welcome Home grant, and that was in collaboration with our other community partners as well. We have a Heart Team update, and basically what I'll do at this time is I'm going to, if I can, I will pass this to my Deputy Director of Social Services to just discuss a little bit about the Heart Team update, since, you know, that is her area.
So good evening. Thank you, Director Jackson Shahid. You need this closer to me. Okay, I saw your gesturing. So just to give you a quick update on the Heart Team is celebrating tomorrow its third year of implementation, and it continues to be a best practice model for an alternative crisis response program. To date, they have serviced over, actually today I heard it was 4,400 calls that they've gone out on, and 81% or so, it generally hovers in the 80% area, that those calls have gone out, they've gone out by themselves without any co-responder, so not with PD, not with HFD, and not with EMS. But they are going to some of our low-level calls, allowing the police and fire and EMS to concentrate on some of the more acute situations that they should focus on. Even in terms of the warming center, we had a recent situation where there were a lot of calls in December and January for the warming center. We asked Heart Team to go out and do targeted outreach in that area, and they decreased those calls by about 75%. So it was a significant intervention, and it continues to be a great service. So CRT responds to calls without the police. Wheeler responds for youth crisis, and they respond with the police or ambulance, and they have increased their calls. It's always harder to get them going, but they increased their calls by 53% from one quarter to over a year's period.
Thank you, Patricia. So some of our upcoming activities. So we'll be hosting a balanced program for seniors, Tai Chi Chuan, which is a form of martial arts, and that is going to be funded through our fall prevention grant. We have an annual community engagement event for environmental health, and that is an education seminar for food business owners. And what we're trying to do is, as we raise our standards of food safety in the city of Hartford, we want to make sure that all of our businesses are educated about our standards. We want to make sure that they know about the requirements for running a business. And what's required of the staff, right? So we want to make sure that we build this relationship with our business owners, so that we can make sure that when we're talking about food safety, we're talking about improvement for our community and raising the standards for our residents. MIOP will be presenting at the BIPOC Climbing Affinity Session. MIOP will also be sponsoring the Confident Birthing Session, or program that I have previously discussed, promoting birthing plans and patient rights. And that will be in collaboration with community advocates as well as our hospitals around the city of Hartford. REACH will be doing a supported walk audit, health expo, and other nutrition-related activities. Our Welcome Home will have a sponsored community housing resource fair, and that will be in collaboration with some of our community organizations. And that's really to educate our residents who are interested in home ownership and some of the resources that are available to them. Hartford Public High School Public Health Day celebration, and we will be doing multiple vaccination clinics. And that will be done by our disease prevention clinic. So some of our strategic initiatives that we will be doing will be restructuring the Public Health Accreditation Board targets, and that is basically going to be based on the new federal administration's vision. So when we first applied for the FAB accreditation, they had different requirements and domains that we would be basically judged on, and due to our new administration's regulations around equity and other topics or areas, we will be restructuring some of those focus areas, according to FAB. And it's not so much removing anything that is beneficial for our residents or our department, but it's more so about restructuring the language that will be used or what they will be looking for as domains, because some of those have changed. Implementing a workforce development plan with state funding, updating WIC nutrition positions to improve salary and retention. And this is, definitely really important for WIC. WIC positions, they have been stagnant for quite a while. And I think that with the credentials and requirements that people are required to have for these positions, that they need to be, we need to look at them and make sure that people can survive when they are, looking to work with our WIC division. Restructuring a bit the HHS Public Health Clinic. I mean, we're very excited about that because we now have our APRN, our clinician, and we want to make sure that the services that we can provide certain services for our community. Things are changing in our climate, our political climate, and so there are certain individuals that may be left out in terms of clinical services and who can receive what type of services. So we're trying to restructure so that we can provide services to those in need or the populations who are most vulnerable. Strengthening community connections in maternal child health, positively impacting birth outcomes and child safety. Enhancing our nutrition services and home day care, and also influencing housing policies to increase home ownership and improve community health. I mean, this is really important because we're working on that many ways. Right now, our Welcome Home grant, we really have a robust outline around I don't really want to say, redlining is so outdated right now, but I think with the way we research and the way we do things, it's more electronic, right? So we have a team looking into how some of that influences our housing policies. So our budget comparison. So I'm just going to focus on our totals, and then we'll just get into maybe some significant features, as I don't want to go through the entire table with you. So the budget increase of $207,947, or 3.3, really is driven by union and non-union salary adjustments and a shift of some grant-funded positions to general fund. We have a new medical biller position, an additional funding for South Park Inn and McKinney Shelter, and basically some uncertainty regarding the fiscal year 2026 projected grant expenditures. I think, many people know how public health right now is being targeted. So in terms of our grant funding, some of the grants were halted a little earlier, a few months ago, and then we got the clearance to continue work as usual. As of right now, we did receive some stop work order from the state of Connecticut for our ELC grant, our ELC immunization, and our ELC2 EPI and lab capacity grant, but we have not had our contracts terminated. So, the state of Connecticut, we really appreciate everything that they're doing, from the governor to the AG's office, and really fighting for our public health funding. So we hope that we will get those reinstated. And we're positive about it, but there is some uncertainty with certain public health funding. So just some budget highlights and areas of focus. So we really are, trying to protect public health essential services for the health and wellness of the city of Hartford, the city residents. Advancing community health with APRN services and public health clinic. Increasing our revenue through improved billing functions We want to improve food licensing and inspection processes. We want to increase enforcement of sustainability or sustainable environmental practices. Example, the plastic bag ban, right? Because we still do have quite a few businesses that we do catch using the plastic ban. And we're trying to do a lot of this through not only just improved systems, but also lots of education, especially around our food safety. And we are also, on the front lines when it comes to protecting the public health essential services. Most directors of health are also members of the Connecticut Association for Directors of Health, and we are doing all that we can to also ensure that we continue to get the funding that we need to provide services. So our staff compilation of employees. And just so everyone knows with the table, the numbers are actually percentages. So our residency for the city of Hartford, 42% of our staff live in the city of Hartford. 58% do not live in the city of Hartford. In terms of race and ethnicity, for Hispanic and Latino, it's 23%. For African American or Black, it's 52%. Caucasian or white is 13%. Other is 10%. And prefer not to say is 2%. In terms of our gender, we have 75% female, 22% male, and 3% prefer not to say. And just a quick note that if the columns add up to greater than 100%, it may be due to individuals choosing more than one category. And that is all we have for you this evening. Thank you.
Thank you, Director Jackson Shahid. We're going to have one round of questions, and we're going to start to my left on the screen. Councilman Thomas, any questions?
Thank you, Chairman Milkar. I just wanted to say thank you so much for the presentation, and I do have a few questions about the HEART team, but I am going to follow up through email. Thank you for the presentation.
Thank you. Councilman Gale.
Yes, thank you, Mr. Chair. I'll ask some questions about the HEART team. Fill me in a little bit about how this is funded and who the actual employees are that are functioning as part of the HEART team. I don't really see anything in our budget, any line items in our budget that seem to fund the HEART team. So while you're discussing it, if there's some particular line item you can point to that is funding it, or some FTEs that you can point to in our budget book that are part of this team, I'd appreciate learning that as well. Thank you.
Sure. I'll let my Deputy Director of Social Services answer that question.
The HEART team started with COVID savings that were generated from the health department for the fact that during COVID, in the very beginning of COVID, people were not going anywhere, and so there were lots of savings. Mayor Luke Bronin at the time identified $5 million to create an alternative crisis response program or a community response program in response to 911 calls that come in for people who are emotionally distressed. And so this work started in late 2020. There was the formation of an advisory board, many stakeholders from the community as well as within the city departments, met for about 6 months, created recommendations to the mayor, which were accepted, and the RFP process began. So in 2021, we started with an RFP process to identify vendors who could support some of the work that we were looking for. We already had a strong relationship with Mobile Crisis, so we look at HEART Team as a partnership with 3 agencies. Mobile Crisis, which is actually state funded, and so they don't provide us data at all, so usually when I'm referencing data, it doesn't come from them at all. They respond to the most acute situations with the police, and they've had that relationship for, at that time it was 20 years, so now it's probably about 23 years that they've had a relationship with Hartford Police Department. to respond to the most acute situations. So what Heart Team funding ended up going towards was a program with CRT. They are funded to provide a clinician and a peer, someone with lived experience, who respond to calls together, generally without the police, but they do carry police radios. They do go out with the police if they have to, or they have constant communication with dispatch. So it's almost as if when you call your dispatcher, you have the option of police, fire, ambulance, or mental health services. Wheeler is specific to youth under the age of 18 who are in crisis, and their calls are usually generated they're usually called by police, sometimes by dispatch, and they are contract with many other providers, so their volume of calls is much lower, much lower, but they do respond to youth in crisis, many different behavioral health issues. They have contracts with the school, with DCF, with 211, so they respond for lots of people, but the calls that come in through the police generally get generated their way. I think that the reason, I don't have the firm reason, but I think the reason it doesn't show up in the budget books is because it's still under the mayor's office and the general fund. So those funds, those contracts are scheduled to end this October, but there is still ARPA replacement funds that's available for them. So there's a little bit more funding for the program that's just been general fund and now ARPA replacement funds in the coming year.
Are there employees of the health department that are functioning, or is it all outplaced with Wheeler, CRT, and mobile crisis?
It's all outplaced. So we don't pay mobile crisis, but CRT we do fund. They present many reports quarterly and then an annual report. They have 2 teams. They start from 9 o'clock in the morning. They really start at 8 o'clock and they end at 10 o'clock, but they are dispatchable. They're available for dispatch between 9 a.m. and 9 p.m. Every single day of the week, including holidays. So they have 2 teams that respond. They have an overlap in the middle of the day.
So while you're not providing any direct staffing, they are reporting to you results?
We have monthly operations meetings. We have, right now we're actually having monthly expansion opportunity meetings because we have been speaking a little bit more with Hartford Fire Department as well as emergency medical services to see about going on more medical call types and better partnership with them. Medical call types become a little bit more challenging. There was one medical call type that we added last year, which is to non-fatal overdoses. So Heart Team can be called to non-fatal overdoses. If someone refuses to go to the hospital, they can still have a wraparound service to provide them with support, get them into services if they're looking for that.
And has the number of calls that they've responded to, has that been increasing year over year?
So it actually hasn't been increasing year over year because there's been a decrease in calls to dispatch altogether in the past year. You know, we've had a reduction in crime, and I think the reduced calls means a few reduced calls to Heart Team. But the other way that we use them when they're not being dispatched is for the targeted outreach, for example, at the warming center. And today when we had a meeting, one of the operations meetings we held today, we were talking with fire and ambulance to say, are there high-risk areas or high concern areas that you wish, and PD, that you wish for us to go out to. So we have a constant communication and an opportunity to continue to build the program.
So it's not the case that the police have, or dispatch is intentionally not sending calls to you, there just are fewer.
Very highly regarded by the first responders, which is why we have the conversation going now about how to expand to our other first responders, because even though we've been supporting fire with some of their frequent calls, the medical call types become a little bit more challenging because there's a different protocol. And then you're talking about state departments like OEMS and other people that you need to have in the conversation around what's appropriate. They can't hand off they can't hand off a medical call type to a lower level of care for behavioral health unless it's approved. So even just getting the non-fatal overdoses approved through their system took a good bit of work, but we do lots of relationship building and lots of ongoing opportunity discussions about collaborating together.
Well, I wish you a lot of luck in that. I would say that the Heart Team is also highly regarded by at least this member of the public as well. I've seen it in operation, and I think it's a great advancement here.
There are many
within the city.
residents who are just like, thank you for coming and not having the police come, right?
Yeah.
I mean,
No,
it's the appropriate response for the call type and getting you the appropriate kinds of services rather than having enforcement all the time, yeah.
Yeah, thank you.
Thank you for your
Mr.
comments.
Chair.
Thank you. For my first comment before I ask my questions, the T-Dice, that needs to be replicated as much as possible. It's an amazing program. I've danced with them several times, and I've had as much fun as they have, so it's a great program. First question, let's start with the easy one. If you look at your detailed budget book, the one with the object line, the rows, the almost 2,000 rows. When I look at that section, like row 1552 through 1555, those four, when I look at them combined, transportation, McKinney's shelter, women's shelter and overflow, the no freeze warming center. When you look at every year since fiscal year 2022, the expenses are almost in alignment with what was recommended or adopted for the budget, almost 100%. Then last year, FY24, the expenses were about 75% of what was adopted. So the expenses didn't quite reach what was adopted. Then now this year, half of the year only, in 6 months, we've only spent $13,000 out of $1.2 million. Can you explain to me how that works? Because if in 6 months only $13,000 out of that 1.2 of those four lines together, when other years the line items have been spent, can you explain how that works so I could have an idea of why no expenses are showing up?
So I'm going to let the MSO express that.
Thank you very much. The reason why it's so low is because we're still trying to get the invoices in to pay. The
Get it
invoices
closer.
have not come in yet. So we're still waiting to get the invoices to come through. They haven't come in yet. That's why the expenditures were so low.
Okay, so it's a timing matter.
It's just exactly. It's the time we're waiting for the vendors to submit the invoices in.
Okay.
Yeah.
Okay, so this is a good segue to my next question, which is not related to this, but it's related to the timing piece. When I look at your grants on the back of the book, I do see some grants are higher, some grants are lower, like every other year. I've had this similar concern, not concern, but comment with another department, but I'll make the same comment to this department, which is that I can make the assumption that in some cases, some of the grants for these that are being recommended for this year, the amount is what it is based on carryover funding that you're expecting to carry over to next year.
Right.
And that has happened in previous years.
Right.
Obviously, I did ask to hopefully have that column that shows carryover. We'll see if that makes it to next year. But in the meantime, this leads me to this question: how comfortable do you feel that the department is efficient in spending grant money during the period that it was intended to be spent? I not only in public service but also in nonprofit, this has become the one of the biggest conversations around, that we don't get to spend the grant money during the period that it was intended, so we not only lose overhead funding or admin funding, but we also run the risk of not being able to carry it over to future years. How do you feel about your grants within your department?
Go ahead. I'm going to let the MSO express, and then I'll just add on to it.
So, thank you very much. So basically, the way it is first of all, if we get the grant like the first year, it takes us a while. Like let's say a grant will be dated October 1st. And maybe we don't get to start it. We have to do contracts, hire employees and everything. By the time we do all that, that will bring us to December, January. So that leaves us 3-4 months unspent of anything from the grant. And then once we get the contracts and the employees on board, then it takes us like few months for us to write the contract, get the mayor to sign it, everybody to sign it, and then we can start paying the invoices. While they are still working, it takes us a while to get all the city members to approve our contracts. That's why a lot of times we see a lot of grant funding monies are not being spent. Normally, towards the end, that's where everything like kicks in, because we have to make sure we captured everything before we close out the grant. So at the end, we make sure, like right now, for instance, we have Ryan White Part B ended March 31st. We're still waiting for invoices for February right now to pay. So those are kind of examples that we are dealing with right now, because we lost one of our main person that used to oversee the program. So things like that slow us down a little bit. That's why a lot of times you don't see like grant funding programs and monies are not being spent. They will be spent by the time the fiscal year of the program ends. It's just a matter of time that once we get the invoices in, that's when we make sure they get spent. They are being spent, you're just not seeing them yet.
And I'll just add to that, because he's talking really from a technical point of view, but just as an overview, we normally do not have issues with spending our grant funding. It's very few times that we have to, carry over. The grant that we probably carry the most over is the per capita grant. And a lot of times the reason why, for the per capita grant that there's carryover is most health directors at times, we use that as our contingency plan, right? Because that is to support the 10 essential functions of public health. So that is our grant that we're given by the state, and that supports any programming that we would like to do that supports these functions of public health. So that's almost like our contingency fund, because I have direct, care over that grant in terms of what we're using it for. For that grant, there will be times where we will have carryover, and that's usually because we're trying to say what's going to happen with other funding. We could always fall back on our per capita grant. So that would be the only grant that I would say at times has carryover. But for the other grants that we have, there is, a lot of mandated reporting. So it's either a federal grant or a state grant where we are responsible for reporting. And we don't really have the opportunity to do much carryover unless, unless they give us the opportunity to do so. But most of the time, we do try to spend the funding during the actual period.
Thank you. My last question will be, so looking at your presentation, I was hoping to see something, whether it was under strategic initiatives or areas of focus. I was hoping to see something related to food for the senior centers or nutrition. I didn't see it. So then I went to the back of the book to the grant section, and I also see that there's a loss of funding with the ARPA food for seniors. There's some grant that was received in the past. Well, if it was ARPA, it was during the COVID time, so it makes sense that it's phasing out. Only a little bit is left from that line. But I didn't get to hear or see anything regarding that, and we know that that's one of the concerns that we're having in the city now. Do you have any updates or anything that you could talk about regarding your plans as you move forward through the next month as we discuss the budget?
So in terms of initiatives, we try to make sure that our initiatives and priority areas are in alignment with the executor of the city. So not to say that any of our programs are not a priority, because we definitely see our seniors or our senior programming as priorities, our programs. All of our programs are a priority for us, especially vulnerable populations. So in terms of, some funding that actually was reduced, there was a grant, the NCAAA grant, that the Senior and Community Services Program does receive, that did get reduced. And that was some of the funding that was reduced by, that's a government grant. It was reduced about $30,000. And so I know that that hit, majority of our centers in terms of funding. I do know, though, that the mayor does prioritize our seniors, and so we did make some concessions to give seniors additional funding during the fiscal year to kind of close that gap with what they were missing. So I know for this year, if there's any additional funding that will be given to the seniors, that is something that, there will be decisions made on that, and hopefully we can make up for, what has been lost or where there are gaps. But we are trying to also offer alternative measures or methods to get seniors food sources. So for instance, I know in one of our senior centers, they do have a pantry. All of our senior centers do not have that, though. So we're trying to increase some of that type of programming. We want to make sure that all of our senior centers do have some sort of a food pantry set up, so that if they are in need of food items, that they could go to the pantry and possibly take food from there so that they can take home, especially since food insecurity is a priority for the city. So those are some things that we are trying to implement in our senior centers.
Thank you. Council President Sergio.
Good evening, everyone. Thank you, Director, for your presentation. I'm going to stay with the grant area, and I see that you have about, put my glasses on here, about $17 million in grants. Could you just provide what organizations, that receive, I know some of it covers staff, but I'm sure some of it also covers different organizations within the city. So if you can provide me a list of the different organizations from this list of grants that we receive, that would be helpful. I know you talk about the, NCAAA, those will probably go to the senior centers. I look at the WIC Woman and Infant Program grant, which is like $1 million. It covers does that cover all of your staffing? No general funds come from that?
Yes. Yes.
Okay, so that's all staffing?
Yes, all staffing and funds.
Okay. There is your lead hazard reduction.
Yes.
It's about $2 million, but it's about 2 staff. Does it go to other organizations for education?
So the lead hazard grant, that is a state grant, but that gets funneled from the federal government. So that does cover staff in that division for our lead program, but that does also go to subcontractors as well. So what we will do is, honestly, for all of our grants, we honestly subcontract so many different organizations. We would have to get a list for all of our grants and give that to you. Yeah, so that you could have a full picture of all of the organizations that we actually fund with the grants that we're given and that we subcontract with to get the work done.
That would be helpful. Yes, thank you.
Okay.
When we looked at all your achievements for fiscal year 2025, I know there were several nice articles on your RAT department, which I think was kind of cool.
Thank you.
It's like, here comes Superman, but it was kind of cool. But it was great. While I was also listening to Board of Education meeting last night, we have a couple of kids who talked about mice in their schools, in their school building. I don't know if you could help them out there, but it was very hard. It wasn't nice to see our kids talking about, the teachers, the number of rats they collect at the school.
Very interesting. So our rodent control team, we have had a conversation with, because technically our rodent control team deals with rats and we deal with outer perimeter. So we do not deal with inside of the home, right? And inside of certain residential buildings, because that would fall under housing code. And or, you know, central maintenance. So that would be something like maybe DPW. However, since we do have such expertise with our rodent control team, we do not mind, you know, kind of working with other departments, you know, if they need our assistance with, you know, any type of mitigation. But I know that there needs to be, you know, discussion around how we can possibly assist. And that's something that we're open to having discussion about.
Well, I truly hope you're really open to it, because it was very hurtful to look at our kids at the school meeting talking about mice, and they don't know whom or where to go, you know, to get some help.
Okay.
So I would really appreciate it very much if you reach out to the school system, you know, and have your department work with, I don't know, Board of Education, whom, but the school, which the two young ladies was complaining about, oh geez, I think it was Noah Webster? It was last night, the Board of Education's meeting. I think it was Noah Webster.
Okay.
Yeah, I think so. I think it was Noah Webster, that they were complaining about the mice in their school system, in their school. All right. That was my favorite. And just could you talk to me a little bit more about your training position? You know, how many is there, and how is that working out for the, I think it's the sanitation?
Yes, the sanitarians. I will let my chief sanitarian talk a little bit more about the training position.
Good evening. We currently have 3 environmental health sanitarian trainees,
3.
and they're candidates for the food certifications, certification with the state of Connecticut. We are interviewing this week for an additional environmental health sanitarian trainee. Those positions are critical to us because we are able to have them, you know, get the full panoply of what we do before they actually go out independently. It is kind of a long process because there's so much training involved, and you know, they've been doing a great job. I see one of them sitting behind me. Asia?
Oh, we've got a trainee? Oh, wonderful.
Oh, okay.
Great. Could you stand up so we see you?
So we have Asia West and Anna Mae Joyce.
Oh, congratulations. Wow, it's great to see young people. This is wonderful. Now, how do we make sure we hold on to them and we don't lose them? You know, you're going to go through such a wonderful job in training them. We want them to stay and retire here.
Well, we try to treat them well. And, you know, they have done I have one of the best teams ever.
Thank you. Thank you so very much for your services. And young ladies, thank you very much for wanting to work with the residents of the city of Hartford. Thank you, Mr. Chair.
Majority Leader Rossetti.
Thank you. Thank you, Director Shahid and your team. And first of all, kudos on the rats. That's really, I mean, I've witnessed a few leaving this building at night, so thank you very much. This may be explained easily, but do you have this big book, 27-2, the blight remediation team, and maybe you mentioned it in some of your discussion, that we don't have any positions for this year?
Yes, so we no longer have those positions. So those positions were in our environmental department. It was 2 positions that were not filled. And so since we needed the medical biller for the clinic, since we have the EHR, we repurposed those 2 positions that we were not using because we do not have a blight team in our department. We repurposed those positions for the medical biller.
But what did the blight remediation team do that we won't have now?
So I believe the LNI, DPW actually deals with blight, but we do deal with nuisance that is similar to blight remediation. So all of our EHS trainees deal with nuisance, as well as our sanitarians. So we, did not see a need for that position, and those positions have not been filled in quite some time. So since they were what we called, empty positions, we decided to repurpose them for what was needed and critical for the clinic.
Okay, I don't really know what to say. And this may be addressed somewhere in your budget too. What are we doing, or how are we doing it in maybe different ways to address the ongoing opioid crisis in our city?
Very good. So we do have a grant. We have an OD2A grant, which is a data to action grant that we are receiving from the federal government. So we are actually working with 14 other municipalities to actually centralize a system on how we communicate and share data when it comes to the opioid crisis. I think, as the system is right now, it is quite fractured. I think everyone kind of works in their silos. We have different varying levels of, stigma and belief systems when it comes to opioid use, as well as the way certain organizations actually collect data. So what we're trying to do with this grant is actually come together in a area of Connecticut and try to have some sort of a systematic system on how we collect information. And we also are working with the state on trying to fill gaps in that information system. But we do have, what is very positive that is coming out of this grant is that we do have life experience navigators and coaches that are speaking with our residents, as well as educating different industries about what this opioid crisis is and how we can work together to kind of figure out solutions in our individual towns. So we do have that grant, and that's some of the work that we're doing. But I think that is something that is a priority on a national level as well.
What is the timing on that grant?
So we have another 3 years, I believe, for that grant. That grant was a 5-year grant.
So how are you measuring? Where is the data on that grant? Can you show us some of the...
Sure. We can share with you some of the reports out of the grant. There are different, strategies within that grant. Like there's a health equity component. There's also a data component. There's a EPI component. So we can share some of the various components of the grant.
And maybe see,
Sure.
What's working, what's maybe not, if there's anything new. I think that would be something good to know.
Sure.
Thank you very much. Thank you, Mr. Chair.
Assistant Majority Leader Clark.
Thank you, Mr. Chair, through you. Good evening, everyone. One question is, what percentage of your staff is grant funded?
I'm sorry.
What percentage of your staff is grant funded? Because normally our experience is the amount listed in the budget is not a true reflection of the actual budget for HHS, because there are X amount of staff who are funded by various grants that you receive.
Okay. 1 second.
total? But how much is that grant funded? Okay. What page?
Huh? So in terms of exact percentages, it's a little less than half of our department are grant funded. But I believe on 27-2, it is broken down in terms of general fund total and then grant funds total positions. So the general fund total is 40, and then the grants total is 36. And it may vary because we are still hiring for certain positions, but we have also stopped hiring for positions for the ELC and immunization grant. So we were in the process of hiring for another public health nurse, as well as some a health educator or community health workers. But we actually had to put a stop to that due to the stop work order from the state.
Thank you. In regards to senior community services, you indicate that there are 5 for senior community services. Sorry, you probably couldn't hear me. There are 5 positions that are recommended under this budget line item. Is that internal within HHS, or are those allocated throughout the city's senior centers?
I'm sorry, can you repeat that?
The 5 FTE, 5 positions that are for senior and community services. What positions are those?
Those positions are actually in the department.
Okay.
Those are not directly in the senior center. All of our positions in senior centers technically are subcontracted out with other organizations. So for instance, our South End and North End, it is, there is Blue Hills, right? And then there is, I think, Hispanic Senior Center, and then Parkville. So Parkville is with Parkville Inc. Hispanic Senior Center is through Catholic Charities, I believe. And then the South End Senior Center is through Blue Hills? Yes.
Catholic Charities?
It's through Catholic Charities as well, yes.
So let's say, regarding our senior centers, in an event that an organization is no longer capable of running operations in our senior centers, what is the recourse for the health department?
So the normal process would be an RFP process. So that's normally what happens if we are, the way it works here is that we provide a budget for the department operationally, right? And then we are subcontracting out for an organization. So if an organization could no longer do the task, then it will probably trigger the procurement process of an RFP. So an RFP would be put out, and then we would see what organization would be able to operationally run the senior center.
Would that be an immediate trigger?
It really depends. I mean, if the organization completely, went under and no longer was able to function at all, not even certain areas where they're, where they have contracts, then I believe it would have to be where we would have to, go ahead and start an RFP process and or see if one of the other organizations that are currently running one of our other senior centers would be open to possibly putting in a bid to run, the senior center that's lacking.
That potentially could be problematic for another organization to take over. However, without saying any names, I think that there's some attention that needs to be made to a senior center immediately, and that's why I'm posing these questions, because I want to make sure that our seniors and their operations are not neglected and that the operations can continue without any lapsing. Go ahead.
Oh, no, I just wanted to mention, we have not heard anything otherwise in terms of, operations being impeded due to any, fault. As far as we know, it is business as usual.
Okay.
And we have been in communication. So if we hear anything, then definitely we will, begin proceedings to make sure that our services are continued.
Okay. Now, I know Mr. Chair had touched upon a little bit regarding food quality, and I know we've had a brief exchange regarding food delivery contracts. So there is a growing concern regarding the quality of food that's being produced at certain senior centers. Those contracts that are available, well, that are present for food delivery services, is that something that's RFP'd out, such as, like, say, a Cisco delivering food to to a senior center, and then they're using that to cook fresh meals to the seniors daily?
So in terms of, are you talking about who's actually hired to cook the food?
No, more so the food itself that's being delivered so it can be cooked. So there are certain contracts regarding food delivery. So if I'm at a senior center, I'm a chef, I'm contracting, there's a RP that was out, and so I am now have to receive food from X company, and the food quality is not the greatest, where we should make sure that our seniors are receiving the best food for it can be delivered, cooked, and then it can be produced to the seniors.
Absolutely. There is an RFP process for that. But if, we usually do have surveys, though, that residents do fill out so that we can know about food quality, and a host of other things, even activities in our centers. I think that if the food quality, or if there's an issue with food quality, we definitely take that seriously. And if we need to revise and see if we need to, get another contractor, then that's something that we would be interested in taking a look at.
Okay. Moving on from that, the public health emergency preparedness. Do we have any staff that is doing that?
Yes, we do. We have a emergency preparedness coordinator. Is that for the FEP grant? Yes.
And what type of reports do they provide?
They provide grants to our regional emergency coordinator in accordance to requirements from the grant. And those are reports such as exercises that we have to actually conduct to make sure that we, can handle a certain type of public health crisis within the city. And also just standardized reports according to the FEP grant.
Okay. One final thing. I saw the great things that HHS was doing over the recent fiscal year. However, I didn't see in the presentation this great COVID concerns video that was put together. I just found out about it last week. I didn't know that you all produced it. So can you please let us know how that came about, and where is it so that the rest of my colleagues can be able to view it?
Yes, so actually it came about because during COVID, like many of us, we were experiencing it. We were on the front lines. And honestly, I always wanted to tell the story of why people were hesitant in terms of getting the vaccine. I think there was this notion that health disparities popped up during COVID, or now we're seeing all of these, health disparities in certain communities. And, you know, I think during COVID, you know, we really implored certain, you know, individuals to put messages out, right, for, you know, geared towards certain communities. And I think at the time the priority was otherwise. And so I said if I ever got the chance or got the funding that, you know, I would want to tell this story. And we got this opportunity with the immunization grant, and they said that it's for vaccine hesitancy. And so we asked the state if we could do a documentary. And so they said, sure. And so we used the funding, you know, honestly, this immunization grant, you know, we couldn't buy vaccines with it. So if it's for education, you know, what else could we do? So we felt like a documentary is telling the story of the residents. You know, it's really raw and unfiltered. It's really their experience, and it's on film. So we really wanted something that would stand the test of time and that anybody could watch, and it could be, you know, a useful tool, you know, an education tool, you know, a reference, but definitely a part of a legacy. And we partnered with iHeart and you know, a third-party producer, and the film is available now on YouTube, and yeah, everyone can see it. I think that it's Complicated Confidence. So it's Complicated Confidence. It's on our YouTube page, and we've gotten some good feedback from it, and hopefully, you know, we get great feedback from you all.
Is it in Spanish?
So we do have subtitles that, you know, it could be in Spanish.
My only problem is nobody from City Council was invited to participate.
Ah, okay.
Because there was some of us that was knee-deep in working in the out in the field,
Okay.
working on the testing and vaccines. But from what I saw, it was a pretty good video. So congratulations to your team. One more thing is addressing health disparities. What can we do more to? I know there's tons of at times health expos, things of that nature. What can we do more to have more of that in our city regarding health checks, health fairs, that type of thing? Because, you know, sometimes it happens in clusters, and then there's a huge gap. But I think that as we're seeing measles are coming back and other vaccine skeptics and regarding people getting educated and just really people taking care of themselves, how can we produce more of those for our residents here?
Well, if we're talking about from the Department of Health and Human Services, it really would start with our staff and our capabilities. You know, I think lots of organizations are in Hartford doing the work. I really think a lot of it is, you know, about collaboration, which our departments do, you know, amazing jobs at. But it is capital. Well, the industry right now is really moving towards community health workers. I think in the past, the traditional roles were health educators. But health educators, you know, do come with an expense. Right now, we do not have a health educator on staff. We have 2 community health workers right now that were getting funded by the immunization grant. And currently, we have a stop work order for the immunization grant. And so therefore, our community health workers are not able to do the work that they need to do. And so, you know, doing a lot of this work, being on the ground, you know, talking with community, getting the word out there, you know, it really comes down to capital and also marketing. And marketing is very expensive. I do know that the mayor, you know, has a director of marketing coming, so hopefully that will be helpful for the health department in terms of getting the word out there, and I will take full advantage of all those opportunities because I'm a big advocate of being able to use marketing for public health. But it does take capital.
So with that, you said the community health educator,
Yeah, well, the community health workers,
community health, so it's a CHW.
the CHO.
And one of the CHWs, it will act as a community health educator?
Well,
Or is it two separate positions?
well, both of our community health workers were doing that work. I mean, they are at all of our community events, not just for HHS, but for the city.
Yeah.
And they are, they collaborate with many organizations. And right now, our community health workers are not working because of the stop work order. I mean, Julian has been doing an amazing job with assisting us to be able to cover their salary up until a certain point. But once the grant ends, we're trying to see what else we can do to try to implement them into our department, possibly using grant funding, but
It's okay, so
yes.
that's what it was missing to me, is grant funded. So what is their salary plus fringe?
That is something that we can get to you.
Okay, please do. Thank you, Mr. Chair.
Thank you. Councilwoman Biladu.
Thank you, Mr. Chair. Thank you to you and your staff for your presentation. Thank you for the great work that you do. My first question is on the improved food licensing and inspections process. How many staff are there for that right now? Will this improved process increase revenue at all? And what do these improvements look like?
I will let our chief sanitarian answer part of that question.
Hi. We have one of our food permitting desk workers here, Erica Perry. Okay. Thank you. And we work closely with Muhammad's office, actually, Andre Scott, on ensuring that the permits are collected in a timely manner. So this is the second full year that we have used online permitting. We don't have paper, applications anymore, and we're not going to be accepting any business checks or personal checks anymore either, because there's just too many that bounced. So we're looking forward to using, we're working within the Acela program and also through Munis.
And when you go out and you're doing the inspections, more businesses will be covered. Will there be any improvements in revenue for more food licensing?
When we find unpermitted food establishments per the FDA model food code that we're using, they are not allowed to operate. So they have to be shut down until they can comply with all of the regulations, not just our regulations, but our partner agencies also.
And does this include food trucks?
Yes, yeah. We have decals on the food trucks. I know this year it's red. We haven't selected a color next year, but on both sides of the food trucks, you should be able to see a small decal. That means that they are permitted for the fiscal year. So they have gone through not only the health department, but also they have to get a license through DDS, and they've had an initial inspection.
Okay, thank you very much. And my second question is about nuisance enforcement. What does that include for your department? How many staff members do you have focusing on those issues? And what is the enforcement stats related to that?
For nuisance enforcement? So that's where the environmental health sanitarian trainees enter. So all of the sanitarians, as part of their job description and their increase in pay, is included now. The nuisance inspections are part of their job descriptions. So the sanitarian trainees have taken the lead because they're not fully certified, So they're using, we're using them for the notice of violations, and then also when we have to send packets to the Department of Public Works for cleanup.
And can you detail what those nuisance violations are that you enforce?
Tall grass, 12 inches or more, so overgrown vegetation, standing water, and raw open garbage or any kind of bulk garbage that's, from the sidewalk to the property. So anything on the curb we don't do. We've also used the state public health code for several nuisance violations. We have to be judicious about it because, it's not black and white the way the city code is. And some of those include, trying to talk about the rodent, the hazmat. Yes? Okay. We recently used that code we had to require a particular food establishment to have a hazmat cleanup due to mice infestation. So, we don't use that code all the time, but that's there for us.
And so are these actions related to reporting violations, or do you do inspections related to nuisances, or is it both? The nuisance complaints come in through 311 as a service request, and then we also have a fair amount of self-reporting, and we have so many phone calls about complaints. We always try to make sure those are put into an enforcement case so that we can follow that. And I'm sorry if I missed this, but how many staff handle these type of complaints?
So we have 3 lead nuisance complaint inspectors, and total others are 6. So a total of 6.
Thank you.
I just wanted to add, in terms of policy improvement for environmental division, so just a few things. We did hire a program manager for environmental health. Prior, there was just the chief sanitarian, and so a lot of the policies are really state regulations, FDA food codes, but the processes that we were following in the actual health department was something that it was just done, right? But they weren't really written down. And since we're going through our FAB accreditation, we need to make sure that we have all of our policies and procedures in-house actually documented. So that individual was hired for really writing all of our policies down and really making sure that everyone knows what those processes are and how we can streamline them. We also are working on clarifying certain closure procedures. Right now, a lot of our procedures are just worded as at the discretion of the health director. What exactly does that mean? So I would have to look at these cases individually. I think that whether I'm here or not, somebody should be able to see somewhere there is a process, for a closure process. As Liz mentioned, updating or our online licensure process instead of it just being complaint driven. That's something that we really have worked on. And one of our largest initiatives in terms of improvement process is cross-training. So we do have these, departments that have a lot of specialties, right, and expertise. So we have our environmental health sanitarians, and then we have our rodent control inspectors that also have a lot of insect knowledge as well. So we have basically started trying to cross-train so that when we're doing inspections, we're not just going in with blinders on and seeing exactly what our expertise is, but actually opening our span instead of calling another inspector to come here and do like another whole, source of a job when you're actually there. So we're really trying to make sure that all of our inspectors, and I just say inspectors broadly because we have our rodent control inspectors, we have our sanitarians, have a little bit of knowledge of everything so that when they go in, they can be a little bit more efficient. So we are definitely working on that in terms of improvement process.
Councilwoman Rosado.
Hi, good evening. So I'm trying to look at your org chart. Where would your inspectors for the rodent fall under?
That would fall under environmental.
Okay. And how many inspectors do you have?
We have 3.
Okay. So I have a question. So let's say, and this is just an example, I have very good neighbors. Their backyards are very clean, thank God. Let's say I live next to someone who doesn't keep their yard clean, and I call the health department. And it doesn't matter what type of rodent services you put out, because that individual is just not compliant. Do your inspectors kind of go out and look around the city to see if they see someone who's not compliant, or do they only take it by a tip line that you have? And what happens? I mean, they go and they give them a citation and probably give them a couple of days to clean it, and if that doesn't happen, is that controlled only by your department, or does DDS L&I get involved?
Okay, so that is definitely layered. It depends on the facility. Is it residential? Is it commercial?
Residential.
Okay, so if it's residential, is it a mouse complaint or a rat complaint? So
Both.
that
Both.
changes.
Both.
Okay, so anything that has to do with mice inside of the home, that is a housing code issue.
No,
so that will go
outside.
to
I'm talking
L&I.
in the backyard.
Outside, if there are rats outside, then that's where the rodent control team would go and do some investigation. So we do accept complaints that come in through 311, and we also do active scouting. So our rodent control inspectors, do have their own divisions, or their spaces that they work in terms of the city. And they do, have like a schedule where they go out and do active scouting for things that you're talking about. Like if there's a business that, has an area with lots of garbage or something like that, they will go and scout and see if there's any type of burrows around those areas. And then they make reports, take notes. They do reach out to owners. They educate individuals on what they need to do, and then they also can mitigate. So that's what our gassing machines are for. So if they do find burrows in an area, they're very proactive. They really just get the job done. So our guys literally will just, if they see burrows, they have moved things out of the way themselves to make sure that they have access to the burrows, and they will just go ahead and gas on site. So we do a little bit of everything. And if we see that a department needs to be brought in, or that is not under our purview, like something may not be under our purview, we will reach out. And we will also educate whoever, if it's the tenant or if it is a owner, on who they need to reach out to as well, to receive all services that they need to receive, because it may not just be rodent control, it may be something else.
And I'm sorry, you said 3 inspectors?
Yes, there's 3.
Okay. Do you believe you need more inspectors in that department? Do you have a backlog of complaints?
Liz?
I think our rodent control inspectors we're in pretty good shape with the ones that we have. Hopefully they stay, because they're really phenomenal. For the nuisance inspections, we are getting into the high season now. The growth is going to start coming up, and, really there are pockets of garbage in places that we didn't see before. So we'll have referrals from our rodent control inspectors. They'll come back and explain and describe what they did and then what we can further do, or if they've been able to mitigate the situation immediately with the property owner. So we are expecting, more calls this coming up. We're into the season for at least 8 months of the season, and we're also trying to maintain to keep the mosquito population down too, because that's coming up, very soon. There'll be broods starting, with all of the dumped tires out there and everything, and standing water. So, you know, our sanitarian trainees are really busy during this season, and the sanitarians, it's really a stretch for them to do both nuisances and food and the other environmental issues that come up. So we're keeping the pipeline open for the trainees. Thank you.
Okay. And in your management team, besides Jessica, I was hoping I see Jessica today, do you have any other Hispanics?
In our administration? So we just have Jessica, that is ethnically Latino. And then Patricia also does speak some Spanish. But we're always, you know, looking to, you know, hire individuals that speak multiple languages. That is something that, you know, we try to do. In our senior and community services, I know that we hired a program manager that does speak Korean. We have several individuals that speak multiple Southeast Asian languages as well, such as Urdu and Hindi and Bengali. So, you know, we also have someone who speaks Haitian Creole and speaks French. So we try to make sure that, you know, our department is diverse.
I just have one last question, Mr. Chair. The fall prevention grant, do you, I mean, I know you can't predict, but is there funding right now left, or have you used any of it up?
Yes, right now there is funding around available. It's only $50,000 for the year that we get. This is the second year that we are in. So considering what's going on around the country, that might be targeted, but we're not sure at the moment. But yes, there is funding through end of September. At least for now, we know for sure. We don't know what's going to happen tomorrow, so.
Okay, thank you.
Yeah.
Thank you, Mr. Chair.
And the last question to close this presentation is vacancies. How many vacancies you have in your whole department?
We'll get back to you with that number, that exact number.
Thank you. Thank you, Director Jackson Shahid, for this presentation and for sitting with us for an hour and a half, having this amazing conversation and discussion about your department. Thank you to the rest of the leadership team that came along with you and the staff that took of their time to sit here and, you know, learn about the process and support your team. So thank you very much. We're going to take a 5-10 minute break before we transition to the Human Resources Department. Thank you.
Thank you.
Okay, hold on. All right. Well, thank you. Welcome back to those that are watching through HPA-TV. Now we're moving on to the budget presentation from the Human Resources and Labor Relations. With us tonight, we have Director Marlene Fleeting. But before she takes the floor, we'd like to say thank you to the HR team for bringing these goodies and this bag. And, oh, this is like a water bottle. Beautiful. And a whole bunch of papers that we're so excited to read. So thank you for that amazing gift. So Director, so you have the floor. Can you please introduce your team? And I know you have pretty much your whole department behind you. That's amazing. So thank you all for coming and supporting your department. So the floor is yours.
Okay, thank you. Good evening, Council President Surgeon, Council Chair, Assistant Majority Leader, and members of Council. I want to thank Mayor Arunin and COO Ajahi for the opportunity to present the budget for FY26 for Human Resources. Speaking of my great team, I have to my right my Assistant Director, Pamela Ratty. To my immediate left, I have Deputy Director Deb Carabillo, and to her left, Benefits Director Rich Pokorski. I also have my team with me behind me, Aretha Wood, who's my Executive Assistant. I have Stacy Castiglione, who's our Benefits and Wellness Manager, Lauren LeBoy, who's our HR Benefits Analyst. We have our front office staff, Nellie Andrades, who's our Senior Administrative Analyst for the front office, as well as Michelle Cooper, who's our Admin Assistant. We have Elena Acevedo, who's our Admin Assistant, and we have our HR Analyst. We have our Principal Analyst, Nadia De La Punta. We have Senior Analyst, Brittany Hugh, Aaron Presbeck, and Eric is not with us, but he's with us in spirit. He's in grad school. And we have our two analysts, Darian Stevens and Bruno Casanova. I have a wonderful team. I cannot even tell you how tirelessly they work every day for the City of Hartford in HR. So I appreciate you all. Okay, so the Human Resources mission statement is the Department of Human Resources is committed to providing effective guidance and support to all city departments with respect to hiring, managing, developing, and retaining employees, labor relations matters, and benefits administration. By establishing human resources policies and procedures, the department provides fair, consistent, and clear standards to be applied by the City of Hartford as an employer. The department provides direct services in the following areas: compensation, classification, benefits, employee relations, labor relations, training and development, recruitment, and HR technology. In addition, the department serves as a resource to department heads and city administration on matters involving collective bargaining agreements and state and federal employment law. Our organizational chart, you can see on the screen, we have the administration, we have employment services, we have our labor relations, and we have our benefits. We have 17 full-time positions. Our FY25 highlights, we have our marketing initiatives. We had 2 12-week bus ad campaigns and 2 13-week radio ads, including specific department ads in promoting the city career fair. We attended the Hartford Promise in the Department of Labor job fairs. We advertised on Indeed, Careers in Government, CCM, and other applicable sites. We hosted our first annual City of Hartford Career Fair with participation from every city department. So here you'll see pictures, and it was a really, really great time and a great turnout. Some of our highlights for FY25 and benefits: we initiated a 8-week Cigna preventative well visit campaign, which increased city's adult well visit completion rate from 57% to 65%. We increased virtual care utilization from 19% to 25%. We reduced our steerable emergency room visits by 11%. For FY25-26, overall health plan increase was 3.9%. Excluding the over 65 years of age in the state of Connecticut plan. For health and wellness, employees engaged in the following free services offered through the benefits division throughout the year: biometric screenings, mobile mammograms, flu and COVID vaccines, BP screenings, back and chair massages and chiro PT visits, weekly mindfulness workshops, health and wellness challenges, weight loss and step challenges, healthy eating, hydration, sleeping, and stress management. Up under Employee and Labor Relations, we continue to collaboratively work with leadership in city departments to identify critical vacancies and negotiate change to job descriptions, pay, and qualifications to reflect current market data to assist with recruiting and retention. From March 2024 through March 2025, we updated job descriptions and/or pay for an additional 22 classifications, with an additional 10 classifications in process of being created or updated. We closed 25 grievances to date in FY25, which is 84%, of which were resolved or successfully denied at the HR level of the grievance process. We successfully negotiated a tentative agreement with Local 1716 for a successor collective bargaining agreement, which is currently pending approval from Council. Some highlights with recruiting and training. To date, HR has administered a total of 17 examinations, including 3 entry-level police officers that included written, physical agility, and oral examinations. The recruitments resulted in 409 applications and 92 candidates sent to Hartford Police Department. Professional testing for police lieutenant and police captain. Entry-level firefighter recruitment, 3 ES&T dispatcher trainee recruitments, and we updated our software to eliminate technical difficulties as well. These recruitments resulted in 81 candidates tested and 47 qualified candidates sent to ES&T. We also had a promotional maintainer 3 exam that resulted in the internal promotion of 5 candidates who received their CDL through DPW's training program. HR has been working with departments to conduct supervisory and workplace training, including working with Department of Children and Family, Children and Youth during professional development days. Some other things, we worked to develop a new colleague orientation, which is these bags that were given to you. So the new colleague orientation, we give out these bags with a nice little swag inside, as well as a folder with all of our benefits and things for new people that comes in, new colleagues that come to the city. HR also worked with the Mayor's Office and City Council to host the Hartford Honors event to celebrate and thank employees for their hard work and dedication. This was something that was a vision of Council President, so we were able to bring this to fruition in working together. So it was really, really, a really great event. Our strategic initiatives: to negotiate collective bargaining agreements that are fair and equitable, continue to partner with departments to prioritize the hiring of Hartford residents, particularly within public safety positions, continue to update policies, departmental procedures, and job descriptions, provide mandated and optional training opportunities to city employees, continue to automate HR systems to reduce administrative burden and increase organizational effectiveness, to foster an employee's overall work-life balance through the valued benefit packages offered and the ongoing health and wellness initiatives provided. In FY25, our budget was $2,217,985, and now our FY26 recommended is $2,221,397. It represents a 0.2% increase, and the variance is driven by union and non-union salary increases that are offset by a decrease in part-time expenditures. Some budget highlights and areas of focus for FY26 budget highlights. Approximately 50% of FY26 budget is allocated for recruitment and testing. FY26 budget includes funds for 1 police promotional exam, 4 fire promotional exams, and continued marketing strategies. Areas of focus: we will continue to focus on ways to attract Hartford residents for jobs to the fullest extent possible, with a focus on diversity, inclusion, and representation at all levels. We will continue to look for opportunities to enhance employment development, engagement, and satisfaction, with the goal to increase employee retention and upward mobility. We will continue to partner with city leadership, city departments, and the unions to identify critical vacancies and to update or change job descriptions, salary ranges, and qualifications to assist with recruitment, retention, succession planning, and employment transitions. We will continue to encourage and engage all City of Hartford employees in ongoing training opportunities, including EEOC, ADA, diversity, inclusion, and workplace sensitivity, OSHA, supervisory, labor relations, reasonable suspicion, drug testing, and sexual harassment training programs. We will continue to develop and promote the city's employee recognition program opportunities and the new colleague orientation program. We will continue to negotiate with the Fire Union and the Municipal Lawyers Association and begin to negotiate with the Police Union and the City of Hartford Professional Employees Association for fair and equitable collective bargaining agreements. We will continue to collaborate with the city unions and foster positive labor management relations in an effort to resolve any issues before they escalate to arbitration or labor board complaints. We will continue to review processes, policies, and procedures and implement additional efficiencies within HR and across the city. Our staff composition, we have 23.5% is City of Hartford residents, 76.5% is non-Hartford. You see our race and ethnicity breakdown. 23.5% is Hispanic or Latino. We have African Americans at 35.3%, Caucasian at 23.5%, other is 17.7%. Gender-wise, we have 70.6% female and 29.4% male. And that concludes our presentation. So we'll be happy to answer any questions. We have data in the back, yes. We have more in the back. If you, I didn't know if the appendices, we have all of the breakdowns as far as the Hartford residency for all full-time employees as of February 6th. We have more EEO statistics also. And then we have our new hire statistics as well. That's in the back.
All right. Well, thank you. Thank you very much. We're going to start with our one round of sessions, and I'm going to start on my right side. Councilwoman Rosado, do you have any questions? Okay. No, you. Anybody on this side? Yeah. Okay. So Assistant Majority Leader T.J. Clark.
Okay.
Majority Leader Rossetti, go for it.
Oh, well, thank you very much. Good evening, Director, and thank you for your team, for everyone coming. That's really fantastic. So, in the big book, 18-1, your strategic plan initiatives, and it's partly in your presentation. Here you say continue to partner with the departments to prioritize the hiring of Hartford residents, and then here you say focus. But how do we do that? How do we partner? How do we focus? And what are the mechanisms to prioritize Hartford residents?
Before I let Pam jump in, we've been doing a lot for Hartford as far as Hartford residents. We have sent out flyers, over 10,000 mailers to Hartford residents to identify jobs that we have available. When we attend job fairs, and even when we hosted our own job fair, we have positions, and we try to let them know what is available for Hartford residents. We try to get Hartford residents all the time. We do bus ads, we're on the radio, we do as much as we can, and every time we say something, we focus on Hartford residents. I don't know if you want to add anything, Pam, but.
Good evening. We also are trying to put the word out a little bit more to the Hartford residents that the way that they receive a preference in hiring is that with the new civil service process that went into place about 1.5 years ago, is that when they're on a list that they've qualified and they've been sent to a department, the department is required to reach out to every single Hartford resident that is on that list, no matter how many there is and how many vacancies, to give them the opportunity to interview before anybody outside of Hartford. So we try to do that, and then as Marlene said, with the bus ads and the radio ads, we try to focus them in areas that are within Hartford. So we try to use the buses that are based out of the Hartford station, the radio stations that we find have more of their data and statistics of Hartford listeners, or other data that we use to find who we're looking for certain positions, and then the flyers we do target to Hartford residents.
So with the somewhat low percentage of Hartford residents hired. What do you think the obstacles are? And when you do, have a conversation, do you ask where they, did they see it on a bus? Did they see it? But what are the obstacles, do you think, in the hiring of Hartford residents?
I think overall, there's obstacles in general with hiring right now when it comes to, I think ever since COVID, it became even worse with trying to hire people. We have, you're looking at salaries. We're looking at our biggest competitor. Again, I say it every single year, the state of Connecticut. We cannot, and we probably will never compete with the salaries that they offer. We're competing with hybrid work schedules. We don't have a workplace or a work from home policy, let alone a hybrid work policy. So we're competing with that. As far as Hartford residents, I think we have done over and will continue to do what Pam suggested, but we've done everything for Hartford residents for jobs.
Director, this is just a question, would a work from home or some type of hybrid make hiring easier?
Absolutely, it would increase our rates, I believe, because so many companies offer that option, right? Even if it's 2 days in, 3 days at home, or vice versa. We don't offer that right now. We do. Some department heads, and we've kept this since COVID, offer 1 day a week from home. But when you have people interviewing, that's the first thing they're asking for, or they're asking about the workplace, the working from home rather.
So you feel that could make us more competitive pay versus our hybrid type of situation?
Oh, absolutely.
And through you, Mr. Chair, one last. Again, in your significant features on 18-1, when you talk about continue to update policies, department procedures, and job descriptions, what does that entail for you? What does that mean?
Well, a lot of people know probably that a lot of things downstairs is antiquated a little bit, right? We have job descriptions that are from a long time ago, right? And we have a lot of them. So, and it's a process to do it, but we've taken on working with unions and working with departments to update job descriptions and continue to update policies and things. So, you want to say something? Go ahead.
As far as the job descriptions go, what we've been doing, especially when the departments go and ask for new vacancies, we try to meet with the departments and we talk about what has changed, what is really needed for the position, and especially as it relies on minimum qualifications, because sometimes we have found that they've either been a barrier for hiring people or they've been a barrier for upward mobility. So when we do a job description, we try to meet with the departments, and I always say, people hear me all the time say, take the people out of it and think about what's really needed for your department and in this role. And based on that, what is minimally needed for this position for the person to be successful? So that's kind of like our step one when we're looking at the job descriptions. And then from there, depending on what they tell us, we're either, making minor revisions to our current job descriptions and minimum qualifications, or we're doing overhauls on them or creating brand new ones. And then once that is done, we then, for most of our positions, because most of our positions are unionized, we then have to go and negotiate with the unions about the changes to the minimum qualifications, and they can argue impact, which sometimes gets into salary changes, and there's back and forth, and then the new job description can be put into effect.
And then the last with that, do you feel, because to the point that they were antiquated and you've moved along, and maybe they are kind of a living document, but do you feel you're a third of the way through, 2/3 of the way through? Are you one in?
Well, we have updated or created approximately 100 classifications in probably the last 2.5 years, which I think is pretty good, considering all the other work that we have downstairs. And Pam, do you remember how many classifications we have active right now?
A little over
So we're about halfway through the active positions, I would say. And like I said, we have we said in our presentation, we're actively working on 10 more. Some of those we hope to have done before the end of the fiscal year. So that would be an additional 10. And we've created committees with HMIA and 1716 to identify positions. And so we meet with them and they'll either identify a position or we'll identify a position. And then we'll kind of go through that process, talking with the departments, talking with the unions, et cetera.
Thank you. Thank you, Director. Thank you, Mr. Chair.
Assistant Majority Leader Clark.
Thank you, Mr. Chair. Good evening, everyone. Thank you for your great presentation. Thank you for the swag. I think I have a favorite new water bottle now that I can use. Want to piggyback off of our conversation that took place last year that Councilwoman Rossetti was talking about, the hybrid work schedule being more competitive with individuals, organizations around the state. Where are we in the process with implementing a work-at-home hybrid schedule for our employees?
Well, again, we have the 1 day a week right now, but that is something that we're in talks with the administration about.
One day a week?
So, I'm sorry?
You said 1 day a week?
Right now it's, well, for some, it's 1 day that can
This is
do
the
it.
current?
Yeah, currently.
Okay, all right. All right. Because I think trying to parse my words here. I think the last time we discussed was kind of a 4-day work week, leaving that up to department heads to figure out whether it's a Monday through Thursday, Tuesday through Friday to ensure some continuity. So, okay, I'll have some conversations regarding that. I think my colleagues are still in agreement with some type of implementing hybrid schedule. Now, going back to last year, how would that work with the unions? Would that have to be an agreement as well that you would have to?
Absolutely, it has to be negotiated with the unions. Because there's impact, right? So anything that has impact must be negotiated.
Now, in situations such as 1716, since we have a TA in front of us that's been referred to a committee, after it's passed, you would have to agree with 1716 to a mutual agreement. Does that cause for the contract to be reopened, or?
We could go to them, with a request to negotiate that. They could say no. Most of the time, they're willing to at least listen to us.
Okay.
But yeah, work schedule is a mandatory subject of bargaining, so we'd have to go back to them.
Okay. All right, great. So, that is to be continued. I'll put that on my list. Health benefits and insurance, another big ticket item. My longtime friend is here. How you doing, Rich?
Good, thanks, Council.
Good. So, ongoing conversation as to the benefits regarding our health insurance of our employees. When we're talking about being attractive, it's still, I think, costly, I would say, give or take, for our city employees.
Yeah, so this fiscal year, underwriters, pegged our increase at around 3.9%, which is substantially less than the average 8 or 9% of the municipalities are actually increasing their budget for. So we've done very well on that front as far as the actives and under 65 retirees. It's the over 65 that we have carved out to the state of Connecticut, which actually increased almost 100%. So that was sort of out of our control, and the state comptroller's office basically called us on the last minute on October 3rd, said, you have a Zoom call on October 4th, and after we've sent the letters to retirees, they said our costs are actually going to pretty much double. So other than that, I think the plan itself is doing phenomenally well as far as cost.
Okay. Rough estimate, how many retirees do we have on that plan?
So on the under 65, there's about 520 contracts. Over 65, about 630 or so.
Wow.
Those are contracts.
Okay.
So lives, you probably have 900 or so lives on the under 65. and lives as far as over 65, about 630.
That is a lot.
Well, we don't really offer, you know, a lot of the benefits were negotiated away years
Yeah.
ago. So a lot of people don't have the benefit of paying for insurance after retirement.
Right. So for the current active staff base, I know there's some municipalities are moving towards going on the state plan. Have we taken a look at what those updated costs are?
Right. So like I said, our increase was an overall 3.9%. Overall, city, police, and fire pooled together. Fire and police, they're individually underwritten, so they did have significant increases. But when you pull them back together with the city of Hartford's general government population, our overall increase was 3.9%. State of Connecticut was 9.9% for actives and about 12.5% for retirees. But that was on an overall basis. If the Hartford County adjustment was made, it was like 9.4% for actives and like 12% for retirees. So we were about a lot less. Yeah, so we did look at it. We look at it every year.
Mm-hmm.
So this year, if the decision was made to move over the active increase of the active population, if we moved over to the state, it would be an extra 15% budgeted. So we'd have to pay about $3.2 million more to go to the state of Connecticut. So, you know, sometimes it's better, sometimes it's worse. This particular year, it was a significant increase on the state plan versus our 3.9%.
So even though if it will be a 15% increase on the front end, how much would it potentially save us on the back end when we're talking about claims, promoting healthy lifestyles, encouraging people for their preventative maintenance so that they can become educated to less going to the doctors less when it's not needed?
Well, the benefit to being on the state plan is basically it's a richer benefit. You drop a card and you pay a copay. So you'll always have a higher cost to that kind of a plan. Whether there's a back-end savings, it would be hard to say. I think the state of Connecticut relies on new participants because, you know, the state of Connecticut relies on the law of large numbers. They need people to continue to join that plan and reduce costs. The larger the group, the more probability there will be less outliers in the rate increases. It'll pretty much be a smooth outcome year over year. We've consistently outperformed the state of Connecticut's plan since I've been here, since the plan started, the partnership plan. There's a lot of difficulty even if we wish to move the active population to the state of Connecticut. It'd be a very big lift in regards to the legality around it and a number of different hiccups that we'd have to work through with the city and the unions to do so.
So it's more contractual.
You know, it's a subject of bargaining, number one.
Okay.
But, you know, the retirees are tied into as active people change, the retirees have to change. About 5 or 6 unions have that language. We would have a concern if the Cigna would actually administer the legacy retiree group. If they were just able to do that, that group costs would go up because there's not a credible amount of claims experience. So, you know, it would cost us on the retiree end. It would cost us on the, also, I don't know if we have to budget the run-out costs by being with Cigna. Once we cancel Cigna and go to the state, we have a tail end of claims that would be processed. That's going to be a couple $1 million that may not have been budgeted. So there's a lot of numerous, you know, issues that would arise.
Okay. The insurers for the city are Cigna and who?
Cigna.
Just
Cigna. Well, Cigna and Aetna through the state of Connecticut with the over 65.
Okay.
But I'm sorry, Deb, yeah, you're right. And you know what we did here a number of years ago in 2011, we actually carved out the pharmacy, joined the state of Connecticut's plan. So we have Cigna as medical, we have pharmacy as Caremark, CVS Caremark, and Cigna as dental, and Aetna as the over 65.
Okay, all right. So with the recent news of Cigna and I think the Medicare Part D, does that affect any of our employees or retirees?
The Cigna.
They just sold off a portion.
No, we don't participate with any retiree benefits through Cigna. I mean, nothing over 65 plan. It's all Aetna through the state of Connecticut. So nothing would affect us there.
Okay. All right. Thank you very much, Mr. Chair.
Thank you.
Okay. Councilwoman Rosado.
Thank you, Mr. Chair. What? I'm sorry? Oh, yes, I'm ready. Great presentation, thank you, and I love my packet and all the goodies. So last year, I think we had, I don't know if it was between 170 to 200 job openings. How many do we have now?
One sec. Right now, not including the police officers, we have 157.
157?
Yeah, with police officers, it would be probably, they're about 120 vacancies, so then it would be about 277, 280.
Okay. So in the prior administration, so never mind that. I fill out an application, right? And congratulations, Marlene, to your team, because there was a point the middle of last year where everywhere I went, whether it was the website, a PSA, the bus, right? When I got home, the cards, I mean, it was a really intense outreach. So congratulations on that. But on that note, walk me through, I fill out an application, right? Whether it's through the internet or mail, it gets to your department, what happens?
So once it gets to our department, when the posting closes, because we give that time period for all applications to come in, our analysts will review it. Depending on how many applications have come in and they review and believe they meet the minimum qualifications, we sometimes reach out to the applicants if we're missing some documentation. So a lot of times they have to submit a high school diploma or a college degree, driver's license, certain certifications depending on the position. So we do try to reach out and have them submit what they need and let them know what they're missing. Then after that, they are placed on an eligible register by our analysts, and then depending on how many vacancies are with the department and what department, then the whole list from that posting and that eligible register, all of the qualified people are sent to the department on a certification list. On that certification list, if they, for example, just have one opening, they have to interview all veterans and Hartford residents that are marked on the certification list, and then they need to minimally reach out to 3 candidates for every 1 vacancy to schedule an interview. We always suggest reaching out to as many as possible because you want to see, you know, all of your options, and sometimes it's hard to really know a person with just a resume or an application. So they will do that, they'll do their outreach, and then they will return that list to us if they've made a selection.
Okay, so let me see if I understand this correctly. In the prior administration, it didn't work like that. So Marlene, correct me if I'm wrong. So you guys did away with, I can't remember the acronym, was it PRC, where it went to the mayor, it went to this group, where they vetted that application? They're not doing that right now? Because what I'm understanding from you is you're sending directly the applications to the department heads to do their own interviews.
So PRC was a part of the process prior to posting and accepting applications. And that is still being done just a little bit differently with this administration, but that takes place prior to us accepting applications, if you want to talk about the PRC process.
Okay, so
Can I just
now I'm
say
very
one
confused
thing?
because I asked you, right? The question I asked you was, I fill out an application and it goes to HR, whether it's by mail, and you said blah, 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 blah. Now you're telling me that before that even happens, it goes somewhere else.
Not the application. So what happens is when a position becomes vacant, the department head will fill out, we have a small form that they fill out requesting the backfill for that position. That will go through PRC, which includes our department, budget takes a look at it, and then the administration. Once they approve that, it comes down to our office. We will open it for posting or use an existing list if we had one. But if we open the posting, that is the point that an application will start coming in and we will review. It has already been through the PRC process as a vacancy. Applications do not go through PRC.
So if a department head wants to fill a vacancy, right? They want to fill a vacancy, let's just say HHS wants to fill a vacancy. They're going to put in with their analyst a PRC. Every week, Deb and I meet with administration and we go over the PRC, we get the approval, and the analyst, we give it right back to the analyst, and then they immediately let the department know it's been approved, and then the process begins. So it sounds like a long process, but it's really not.
So are you telling me that the administration only gets involved if, let's say, the health department puts in a request that they need that they need a position? Is the PRC only responsible for saying, yes, you have a budget, it's X amount, and that is it?
Right.
Because the PRC that I knew before didn't work like that.
Yes, the PRC is just that. It is budget, looking at what the department has as vacancy as far as money, the budget, to make sure they can sustain that vacancy, and that's it. So they sign off on it, and then the department can go ahead with the hiring.
Okay. So my other question is, and this is something that I had conversations with the prior administration. Are you looking to update more of these job descriptions with equivalent job experience? Because the minute you put in there a master's degree, a bachelor's, to be a secretary, an executive, a clerical person, right? And you have qualified individuals that don't have, or let's say have only 2 years of college, but are qualified, you can easily say, oh, you don't have a master's and you're not qualified for that position anymore. Is that something that the city is looking into so that we're more welcoming, because the state is doing it?
Yes, we've done that. I'll let you speak in a second, Deb. We've done that we've worked with unions to actually do that as far as the experience and being an equivalent in place of education for that exact reason, right? As you all know, I was the union vice president of HMEA for a very long time. I ran into those examples of people having, the experience but not being qualified. So now in HR, now that I'm in this role, and even before, HR started to work with the unions to say, okay, we do need to look at experience, and everybody doesn't have a degree, right? So now we're doing equivalence, right? So you can have, in place of a degree, we are now counting experience with jobs. So we're doing that with the ones that's applicable.
Okay.
Thank you. Councilwoman Bilodeau.
Thank you for your presentation. Thank you to your entire team for being here and these lovely gifts. Appreciate that. So my first question is, I heard HHS, when they just presented to us, speak about trainees. Is that a trainee of a specific position? Does that change minimum qualifications? And does it affect an increase in Hartford residents applying at all? Because I've come to, in the past with my non-financial, and had interest in an apprenticeship program to encourage Hartford residents to have an entry point into employment with the city. So I'm just wondering if this is relatable at all.
Are you talking about the environmental health sanitarian program that? For
Yeah, they were
HHS?
talking about food licensing.
Yeah.
Yes.
Okay. So yes, we did create a trainee program for that. We actually created it back in 2006 to get people in the door, because it's such a critical position, but they need so many certifications. And we did just update it recently, along with the salary. The salary was increased significantly to try to get more people to want to come in. So the answer is, when they come through the door, they don't need much, because we're going to train them here. So hopefully, one of the reasons why we did it is hoping that we could get more people attracted to the position, Hartford residents who might not have that but have an interest in the position, because we're helping them get the certifications, we're sending them to the classes, we're taking them through the inspection so that they can get state certified. So yes, we're definitely doing that. And so they have 24 months to get those certifications. And then once they get those certifications, they automatically go to a sanitarian. So their pay increases, they're full-fledged registered sanitarian, which is great for the city and great for them. So we've created upward mobility for them and an automatic transition for them to go into the sanitarian position.
Okay, and are there any other departments that have these type of opportunities related to positions that would pretty much only require certifications rather than maybe a degree?
Well, we do it with emergency services too. We'd have the trainee program and they get certified up. We kind of do it with the maintainer positions. They're not called trainees, but they're maintainer one, so that they can come through the door, and then we give them, they automatically transition to a maintainer two. And then we've made changes to the job description so that allows for upward mobility for them. And then also, as you heard or will hear, I don't know if Public Works went yet, they've reinstituted their CDL program. So there's internal trainings for people to get their CDL licenses. So we've been working with them, and they just recently had graduation for 5 internal employees who were promoted to 3, maintainer 3. So yes, maybe there's more areas that we can look at some point in time, but those are our 3 kind of core groups that we've created that trainee program for.
Okay, excellent.
Oh, and inspector too. Thank you.
That I was going to
Forgot
ask
that one.
about inspectors.
That was
Okay,
inspector
that's
two
great.
as well.
I'd love to see that expand in other areas. So, and lastly, I know we've talked about, remote work and such. How do you guys feel about the attractiveness of, say, a 4-day, 4.5-day work week, a pilot-type program? I feel like it would affect more employees than the actual remote work would. So I feel like you'd have, better response and opportunity to affect more applicants.
Right, I agree. There's different, less hours. I know when I started, it was 35 hours a week. Then we went to 37 and a half, and then we went to 40.
And additionally, you have other towns that you can use as an example.
Yeah.
So that's very helpful.
Mm-hmm.
Thank you all so much.
You're welcome. Thank you.
Thank you. Council President Surgeon.
Thank you, Mr. Chair. And thank you, Human Resource Department. Thank you for inviting me for dinner, but unfortunately, maybe next year I'll make it. Just got to tell me earlier. Hey, and the swags, I appreciate it. I was like, wow, we finally, as council member, got a little bit of something. That is good. Thank you.
You're welcome.
Okay, so I'm going to stick with Councilman Billy to talk about the training program. Loved it with HHS, loved it with DPW, and asking if you can get more younger people involved in the city of Hartford. That's a great way, apprenticeship training program. I do believe we put something in our non-financial for several years now, asking about doing programs like this. So if it seems for some reason our non-financials are just not being adopted. In the non-financial last year, I think Councilman Clark asked for a report on the workforce, the life balance report. That was in the non-financial last year. So, and here it is a year now, and we're asking for the same thing again. We really would like if you guys would take a look at those non-financial that we passed at budget time, because it may not have to do with the monetary and the budget, but it does affect, how we set the policy for the city. And if we're asking you for a report to look at, work life, and how we can attract, staff to the city, and if we set the policy, and if you let us know there's a good policy to be set, that's something we could buy into, but we need the data to back that information upon. Uh, You know, and one more other thing is, when I look at your report of about 1,398 employees for the city, I thank you for the ethnic breakdown, but one of the things I would like to see is age breakdown. Because if I listen to our wonderful insurance young man over here, you know, as our workforce is either young or old, is going to affect our overall insurance cost. Right, young man? So it would be great to take a breakdown of that 1,300, you know, employees. So it kind of gives you an idea looking forward, going forward, what we're going to be expecting. And then from that, the young man here can give us an idea of, you know, our insurance costs expecting, you know, over maybe the next, you know, 2 to 5 years, you know, as the workforce maybe possibly change. One of the other financial resolution we did last year, Director, is we gave you a position. And where are we this year? Have you hired anyone for that human resource department position as yet? Because one of the things you said is that, you know, as our workforce is changing, you need to transfer, you know, vital information to new staff coming in. Where are we on that?
Sorry, we did hire another analyst. Thank you for that. We did hire Mr. Bruno Casanova. He's our latest to come in. He's behind me. So we do have Bruno here, and
We did hire Bruno, I'm sorry, and we do have an HR analyst vacancy currently, but that is because we promoted some of our staff. Nadia was promoted from a senior to a principal, and then Eric was promoted from an HR analyst to a senior. So that left us an HR analyst position, and we recently hired an admin assistant, and our goal in hiring that admin assistant is to hopefully get them trained and get them interested in municipal HR, because it is a little bit different than other HR, and to hopefully transition her into that HR analyst role, and it'll be a little more seamless of a transition because she's had some
So who's being trained on the labor relation?
So labor relations, we have been training our senior analyst, Brittany Hugh, as well as Eric Graves, who's also a senior analyst. And then Deb has been kind to train me on much of it as well.
So we're talking 2 people are being trained for Deb's position, because I know she's in charge of the labor relations.
She is, yes.
So,
Myself, Brittany, and Eric, yes.
I'm sorry?
Myself, Brittany, and Eric, yes.
Okay. So if I go back to next year's budget, which is 2026, how long are we training needed? And, you know, I know it's hard to pass on decades and years of information, because I know it's, you know, sometimes stuff is not written down. I've been through that. So what are we talking about, Director, that is your needs to make sure that we have the historical information, so as we go forward and as we, you know, age out of this, we have people who can actually continue with the running of the city. Give me your time frame, you know, of what your needs are. I mean, you don't have to tell me right now, but you can write it down, because that's something we need to plan, some what's the word I'm looking for?
Succession planning.
There you go. Succession training. We have a young man here, you know, how many people are, you know, 55, close to retirement? We don't know this information. And if the city needs to plan for the future.
Absolutely, and that's what we're doing too, so I'll get you those.
Training, rewrite of qualification. It's been decades. I was a council staff in the 90s. Director, you and I came from those days, okay? And we've been asking from the 90s for qualification rewriting. This is going on 20 or 30 years now. I know you said you've got probably 100 done. But this is something that, you know, if we need to get ready for we are in the 21st century, and we keep doing this, we got to stop this at some point, We really and truly need to rewrite our qualification for 2025 and forward.
Here's the thing, I wasn't obviously in HR then, but I do know from before and even today, it's the same statement. To reclass or do the job descriptions, it is a massive undertaking. I know HR tried in the past, they hired a consultant, spent hundreds of thousands of dollars, and things sat in a box because we have 7 labor unions. So in order for the reclass study to even take place, you have to negotiate, and then you have to sit down and you pretty much have to tell and meet with these people, whoever you hire to do it, because we can't do it. We don't have the manpower to do all of this at one time. And so it is a massive undertaking, and it's going to take some time to actually do it. And to do it while you're trying to work and bring in a company, I mean, we have to just look at what's the best way to try to make it happen if we want to do all of them at one time.
I'm not asking for all of them at one time, but do you think between now and next year budget, we can get one union done? Or half of it, or 25% of it? We have to set some goals, you know, and I'm not asking because I know everybody, we only have 40 hours to work. But set some goals to say, next year, 2026 budget, when you come in front of us, you have gotten 25% of it accomplished.
Yeah, we can set
I mean,
goals.
I'm just
We can
using
set
25.
goals.
I would like you to say 100%. You know what I mean? But if you know, but tell me realistically what you believe, but at least it's a start.
Yes. Yep,
And we're
I
not
agree.
waiting for another 30 years from now again, and a younger person, much more attractive than I am, who's going to sit here, you know, and talk about the same issue, okay?
I won't be here either, but yeah.
Right.
Thank you.
But thank you very much for, I was very happy to see the reception we had for all the city staff.
Yes, the Hartford Honors.
It was beautiful to see, you know, everyone throughout the entire city just coming over and speaking and mingling with each other. Thank you very much for accomplishing it. Sometimes you have ideas, you have dreams, and people come, excuse me?
It was a wonderful
It was great,
event.
wasn't
The
it?
employees had a great time. They felt honored, every last one of them, every city department. We also had a special section and time set aside for the employees that were 30 years and over, right? Believe it or not, we have 4 employees that was over 40 years of service, and then we had over 10 people with 30 years of service. So it was, they were there with their families, they received their special, you know, personalized plaques, and it was very, very nice. They were, you know, had photos and good food, and
Nobody
so it
didn't
was
take
great.
my picture.
It was great.
So, yeah, I'm gonna complain here. My ideas, I didn't get a picture taken, but it's okay. I got my swag. I'm good. Thank you very much, everyone, for being here, and thank you, staff, for joining us. It's great to see everyone.
Thank you.
I only have one question.
What?
Yes. Yeah.
Woohoo! We're gonna be finished early.
One question. It's not a big one, but it is a repeat. No, it's not. In fact, I don't even think they have the answer for it now. So it will be a short answer.
I'm impressed.
Because I asked this question last time, and I was hoping that it would be included in this packet, but it wasn't. So let's ask again, and hopefully maybe you could provide this either whether you have it now or in a reasonable amount of time. So when you look at page 16 on your presentation, you gave us the total of employees, number of non-whites, percentage of non-white. So using that same category classification, can you also provide us how many of these positions are managerial positions with the same kind of breakdown? How many are non-whites and the percentage of it for managerial positions? You know, and it's only to evaluate, you know, whether, you know, we're doing pretty good. 62% non-white across the city. It's not bad. Could be better, but it's not bad. But the question is, do we have a similar, you know, percentage or you know, or ratio when it comes to managerial or leadership? So I would really like to see that, you know, fairly soon, if possible, if that's something that you could click a few buttons, you know, and filter and boom. So hopefully that's how it works.
Yes. And we do have a very good variety and a percentage of that. So we can get that to you.
Thank you. Councilman Gale.
Thank you. I'll take his extra question. So, looking at your chart with the 1,398 employees, quick question. The last entry there in the Treasurer's office, it says excludes pension commission employees. Why are pension commission employees not included here?
Well, we don't, I'm not sure, of here, but if they're not general fund positions, they're not here, because the pension employees are under the pension. That's why they're not here, right? Yeah. And they're up under different contracts, so we can add them in here if you want us to, but.
Well, I mean, it's just very confusing to me. I mean, I get that they're grant funded, but HHS, they have huge numbers of grant-funded employees. They all seem to be included in the chart.
Grant-funded is included. It's just that because pension employees don't go through our process for new hiring and providing their employee details and things of that nature, we may not have the data. It has been like that every year, but we certainly can add them in. And we could always, if we don't have the data, we can send an optional survey to them to fill it out as well.
Would be appreciated. Now, we're having the same conversation tonight. Many of these same questions have come up that came up last year and the year before. I know I don't recall exactly what year, but we started sort of identifying a vacancy crisis and started talking about different strategies to attack that vacancy crisis, including the discussion we've had about changing job descriptions in the hopes that would assist in new hires. I did some quick math. It looks to me like we've got about a 16% vacancy rate currently, top to bottom, including the police. Are we making any progress? I don't remember what the percentages were last year and the year before, but it doesn't seem to me that we're making tremendous headway. And I'm wondering if there's any particular, just what your thoughts are on that, first of all.
Before I let Pam speak, I would like to say this. When it comes to vacancies, it is it has been an issue since COVID and before then was trying to hire. So we have challenges with hiring, especially with salaries and especially with, different things that we're experiencing. Would we like to see the staffing level at 0 vacancies? Absolutely. Are we doing everything in our power to continue, hitting the pavement and doing what we have to do? Absolutely as well. We work really hard with trying to fill vacancies and ask departments, they're the subject matter experts, right? So we go to departments, hey, what do you need? Get us information, get us some programs, whatever, if it requires licensing, get us into whatever we need to be in to get these vacancies filled. So we're doing everything that we know how, and we're open to suggestions when it comes to vacancies. But I just want everybody to know that we work really, really hard to try to get Hartford residents, to get the city of Hartford just, employed as a city, right? It is not easy, but we try to do our best. And people have to want to work as well, right? So, a lot of time right now, the average spans of an employee is 8 months, right? So if you get an employee, any organization, whether it's the city of Hartford, Walmart, Stop and Shop, if you get an employee that stands and lasts with you for a year, you're doing a damn good job, right? So it is not like it used to be, right? In our times where I'm a 24-year veteran with the city of Hartford, I love it, and I, hold my record, and I love it, and I like to talk about it. But to have an employee come in these days, in today's time, and work for a year, you're doing good.
I do think, our number in our performance measures as well has gone up for full-time new hires. In FY24, we did hire 281 full-time employees. I think the focus now needs to shift a little bit to retention, because we are bringing in these new employees, but we're also losing employees. So I think that, I know the administration as well, there's a lot of conversations about retention, because we've seen our applications go up, so we know the interest is there. We've had new hires come in, but I think the focus needs to shift a little bit on the retention. So we're doing exit interviews to figure out why people are leaving, and hybrid is a conversation, but most of what we're seeing is the growth opportunities or poor leadership within their department. They're leaving within the first 4 years of being here, which means they're leaving before they're even vested. We are doing some data on ages, because that was asked from the administration. There's a big difference between retaining an employee over 40 and retaining an employee under 40. So we're definitely looking at that, because I think that we have to shift the goal a little bit to keeping and retaining the employees, so that separation number goes down and our vacancy number continues to hopefully drop without it kind of offsetting a little bit.
Well, certainly wish you good luck with that. And it's been said more than once, if there's things that you feel that council could be helpful in that regard, clearly we'd like to know. And, and certainly appreciate the concept of a hybrid work and shorter work week, but so many of the jobs at the city of Hartford do not lend themselves to these things. We can't have a police officer working from home, or a maintainer working from home, a teacher working from home, so firefighter, all of that. Clearly we need some other strategies for, as you say, both recruitment and retaining. So last thing I just wanted to ask, you gave these statistics about how many people applied for police officer job. It seemed like, a large number of people, over 400 people, and 92 of them apparently you felt were qualified enough to pass forward. But I don't think the police hired, I don't even know if they hired 10 of those 92. So what was the disconnect there, if you know?
So we lose a lot of people in the police officer recruitments in the testing process. I don't know if they're fully committed when they first apply to understanding they're going to go through a physical agility exam, which is where we lose the majority of them. A lot of them are no-shows, but of the 92 that get sent to the police department, there are constraints from post that the department and us are kind of stuck under. So the majority of those people don't make it through because of background, the polygraph, and those are constraints that are set by post, so there is no discretion that the city can have in those, but that is the reason that majority of those 92 people didn't make it to being invited to a recruit class. But those are those post standards that we really don't have any wiggle room on.
Say that again, a post standard?
Yes, so post, I can't remember what post stands for.
Police officer standard training.
Is that set by the state of Connecticut, or is that just custom?
No,
That
that's state statute.
Yes.
Thank you. Thank you, Mr. Chair.
Councilman Thomas.
Yes, thank you. Can you guys hear me? I'm sorry.
Yes,
We can hear you.
Oh, sorry about that. Yeah, I had one question, but maybe two. The first one, and thank you for the presentation. I missed some of it, so I'm sorry about that, but I did look over the documents. Thank you. My question was, do you think that you guys are going to be making, I don't know, any official stances, or is there an official stance on AI and the presence of AI in the city of Hartford, and how it, how it can be effective, or if it, is not something that we want to be, using in the workplace? And I wanted to, know your stance on that, if I could.
I know there are conversations about AI, but I will leave that to our Metro Hartford and Infosys Systems director. When Sharice next come up, she can tell you all about it, because that is not my expertise. But I know there definitely are conversations about it.
Got it. Yeah, I definitely understand, them having a huge, input into that, topic. But I will say that other municipalities are kind of in a space of like setting policies towards like what's appropriate and what's not appropriate in terms of AI usage. I'm sure they do that in conjunction with like a, you know, an IT type of department as well. So yeah, I understand that. So thank you. And yeah, I wanted to say, you know, I appreciate, you know, Councilman, our chair, Milkar's question around the numbers of like, you know, comparative to non-white to, you know, white in terms of, you know, finances. But I think it would be really awesome to even see that breakdown in terms of not just them being in managerial positions, but maybe even if we could see a physical breakdown on like, like salaries, but, you know, also just like, you know, like, you know, the dollar amount towards like race. I don't know if that's even possible or, you know, or legal. I'm not sure, but just wanted to put it out there that I thought that was a great question. And I think that's a really awesome way for us to start to look at just, you know, where money is being spent and how it's being spent and who it's being spent on, if that makes sense.
Okay, thank you. We'll look into it and get back to you on it.
Thanks.
You're welcome.
Well, before we close, one last comment. Councilwoman Rosado?
Yes, I just want to say, Marlene, congratulations to you and your team. I love it when, you know, the entire team shows up. That shows part of your dedication when we have our budget hearings. But I was council president for 4 years under the Luke Ronan administration. And so I know how far you've come along to where that department was. And I just want to thank you and your team for your great work and continue to do what you're doing. And, you know, this package basically, you know, says a lot. I have been on council, I think, for 6 years, and I've never had a presentation like this. So thank you very much to all of you.
Thank you. Thank you so much.
Yes.
When I say last, never believe me. Assistant Majority Leader Clark.
This is real quick. It is, no, and I'm not going to ask them for anything. What is it that they need more of? The training. How often can you provide those trainings for people, employees, to get trained for other positions? Such as like the maintainer trainee program or the other training programs?
We do it kind of like on the job. So we hire you as that, and then, you know, you grow from there. So it kind of depends on when there's vacancies, because we can only hire in those positions when there's vacancies.
Gotcha. And Marlene, no, this, trust me, you're going to be happy that what I'm getting ready to ask. Marlene, how long have you been the director now?
For 5 years in July.
So don't quote me on it. I've been around for a long time. I think you are probably our longest serving HR director.
Yes, I am.
Since I've been in this building. Yeah. And Deb is my witness. So congratulations to you. Kudos to you.
Thank you.
Thank you very much for your service.
Thank you. I made it. And thank you all.
And now you're going to announce your retirement, right?
So please keep up the good work. You have resources here. Let us partner together. Thank you, Mr. Chair.
Thank you all. I just want to say, too, we want to say thank you for your support. We know that you guys are here, and we appreciate that from, you know, the last administration to this administration. You guys are hanging in there. Anything we need, you make sure that we have it. So we truly appreciate that. And again, to my team with me and behind me, I couldn't do this without them. We work really, really hard. These young men and women can work anywhere. They're very talented, very marketable, but they choose to come here every day. So I appreciate them as well.
Well, thank you, Director Fleeting. Thank you to the rest of the team for being here and spending this evening with us, having fun and this exciting process. So thank you very much. I appreciate it. And I call this meeting to adjourn.
Thank you.